everyone. Welcome to Health with Dr. Yvette. This is a podcast that aims to correct myths around health. Today, I'm joined by my lovely friend, my colleague. She's a public health promoter, Dr. Namunji Matale.
Hi, everyone. It's so amazing to be here.
It's a pleasure to have you. Been trying to get her the entire week, but finally, here we are.
I apologize in advance. I've had a crazy schedule, but I'm glad to be here. Thank you so much for having me.
We understand. So today we're going to talk about cervical cancer. As some of you may know, cervical cancer is really a nuisance in Zambia right now. And Zambia is ranked in the top 5 globally. You can imagine that. So that means that we're dealing with high numbers. So we are around third. We're the third.
Top 3 around there.
Yeah.
And that's scary, though.
Yes.
In the whole world, not just Africa, the whole world.
Yes. And why do you think that is, though?
Oh, wow. That's a very big question to ask. And there's a lot of issues surrounding that question.
Yeah.
I think not enough people have knowledge with regards to what causes cervical cancer. They don't know that it's actually preventable. It's preventable and treatable at the same time. So there's a lot of issues surrounding that, which hopefully we can get into a bit deeper.
Yeah. So I think people would want to know, what causes cervical cancer?
Okay, so more than 90% of cervical cancer cases are actually caused by infection with a virus called HPV, or if you like, human papilloma virus. I call it the most annoying virus personally. I hate HPV. And stats tell us that over 40% of the world's population has HPV. And they just don't know it.
Yeah, scary.
So you could be walking around and you actually have HPV.
Yeah.
So it's a nuisance virus because it's one of the viruses that's behind genital warts. It's behind penile cancer, and in females, it's behind cervical cancer. Yeah. So it's a nuisance, to say the least.
It really is.
Yeah.
And having that percentage 40%, it means we're seeing 10 people. 4 people have HPV, and we have over 100 types. You can imagine
of HPV.
So HPV is divided into 2. We have the low risk HPV and the high risk HPV. So the low risk HPV is like HPV 6 and 11.
Yeah.
So those will cause your genital warts. Then we have high risk, the most common 16 and 18.
Yeah.
Those are the ones that are mostly associated with cervical cancer. Then we have 31, 33. There's so many HPVs that are associated with cervical cancer.
Yeah.
So what does the HPV do? How does it cause the cervical cancer?
Okay, so first of all, HPV is transmitted sexually. So it's one of the STIs. You know how a lot of people say, oh no, I'm more scared of getting knocked up than getting an STI. And on top of that, they're more scared of HIV. But HIV is not the only thing that can actually harm you. At least we're even in an era where, there are ARVs. HPV has no cure, unfortunately.
Yeah.
And it's transmitted sexually. And what it does is, when your immunity is low, it likes to attack when your immunity is low. Your body is not able to fight it off. It starts to cause changes in your body. So when any cancer is forming, it's because the cells in that part of the body are not being controlled in the way they keep multiplying. Just like people, or a part of people, cells grow and die.
Yeah.
But these cells behave like they're immortal. They just keep growing and growing and growing until they form a tumor.
Yeah.
And that's how even cervical cancer starts. But what triggers it is the changes in the HPV when it infects you. Okay. So that infection with the high-risk HPV starts to cause changes on the cervix, and then you can start to develop cervical cancer.
Yeah. I'm sure some people are wondering, what's a cervix? Because maybe someone is
cervix.
Okay. Maybe someone is wondering, like, what are they talking about? What is a cervix?
Okay, so essentially a cervix is a neck. Okay, it's the neck of something, kind of like how you have a head and a neck. This is actually called a cervix, which is why when someone has like some kind of injury, they wear a
A
cervical
cervical.
collar.
Yes.
So in the same way, anyone who has a uterus, the uterus has a neck called the cervix.
Yes.
So the cervix is just above, where the vaginal opening is. So between the vagina and the uterus, you have the cervix. It's like a neck.
Yes. So, for those who are still confused, when you are in labor and we're saying, oh, you're 3 centimeters, oh, you're 10 centimeters. What we're actually measuring is the opening of your cervix.
Exactly.
So the cervix is the njila ya mwana.
Perfect.
Yes. So, what are some of the things that put people at risk of getting cervical cancer?
Okay. So anything that puts you at risk of getting HPV will put you at risk of getting cervical cancer.
Yes.
For example, since we said that it's sexually transmitted, having multiple sexual partners puts you at risk. Like you said, 4 in 10 people have HPV. So you imagine you sleep with this one, you sleep with that one, who's slept with this one, who slept with that one, and sleep with. So basically, you're increasing your risk of picking it from any of them.
And what if you're using protection condom?
Remember how we said it's a nuisance virus?
Yeah.
Condoms don't guarantee protection from HPV in particular, because even skin to skin contact can still result in someone getting it. It may not directly be on your exact genitals, but as long as it's in the area, you can pick it up, unfortunately.
So it just reduces the risk but doesn't completely
It doesn't
take it away.
completely eliminate the risk of you getting HPV. It's a nuisance virus.
It really is, eh?
Yeah.
And it can affect anything. So you have what's on your hands, on your face.
People's
HPV.
throats are developing strange growths because of it.
Yes, because people have oral sex now,
Yeah.
and it's on the rise.
And people
So-
are getting throat cancer because of HPV.
Instead of getting it on your cervix, you have it on your throat.
Yeah.
Yeah, so
There's a lot going on. HPV is a nuisance, guys.
it is.
Yeah.
It is, and we really need to do something about it.
Yeah.
So apart from the multiple partners, what else can put you
Okay.
at risk?
An early sexual debut, like having sex for the first time at a very young age, increases one's risk of developing the HPV, or rather picking up the HPV, and then it puts them at risk of the same.
Something I've heard. My friend was posted to one of these remote areas in the country, and she was telling me that there are a lot of children, like 12 years, 13 years, and these are pregnant.
It's a really, really sad
and
case.
you find that apparently the mother to that 13-year-old is also pregnant, so they're in the same ward.
Oh my. So it tells you that you have a grandmom and a mom who are both in childbearing age.
Yes.
And not even on the extreme ends, unfortunately.
Yeah.
It's really sad, like the social issues behind some of these things. I mean, early marriage. Unfortunately, some people see their children as a means of getting resources to take care of themselves.
I thought we don't have that. I was surprised to hear that it's still
rampant
happening
in 2023 and 2024. It's so rampant.
That's very sad.
It is.
That's very sad. And the fact that teenager is having a child that early puts them at risk of cervical cancer.
Exactly.
Now, because there's trauma to the cervix, there's an increased chance of you developing those abnormal cells.
Exactly.
Just like when you have early sex, because sex is also traumatic.
Yes, it is.
It's trauma. So there's trauma happening to your cervix, and your cells are not properly, developed and whatnot. So you increase your chance of getting cervical cancer.
Yeah, the exposure is heightened. Exactly.
And also, previously we had a discussion with Dr. Mlowa on male circumcision.
Okay. MC. I'm an advocate for MC. Go for MC.
So am I. So we were saying that if you're not doing it for yourself, do it for your spouse or your partner. Yeah, because when you're not circumcised, you're increasing your chance of getting these STIs, which you can later pass on to your partners. That's true. Of course, we're seeing more cervical cancer than we are seeing penile cancer. So women get more affected than men.
Yeah, because several men are carriers, but they're asymptomatic.
Yes, and you can carry HPV for years without ever developing symptoms.
It just waits for your immunity to take a hit, like it is waiting.
Yeah, so which means that HIV is a risk factor, yes?
Exactly. HIV becomes a risk factor because of your compromised immunity.
Yeah.
Actually, patients living with HIV are up to like 3 to 5 times more likely to get cervical cancer than someone who's not living with HIV.
Oh, yeah, that's true. And also, this is why the recommended age for screening, if you're living with HIV, you're screened from 15 years to 59 years.
Yeah.
Then, if you're HIV negative, it's 25 to 59, yeah, to around the
there.
same age.
Yeah.
So, please get yourself screened, eh?
Exactly.
I've heard some people, there's this myth that goes around that screening is only for people above like 30. So you find 20-year-olds who are sexually active, and you find that some of them have been sexually active for a long time. Yeah, you ask them if they've been for cervical cancer screening, and they're like, no.
It's for big people.
Exactly. And like, it's for big people. How can I go for cervical cancer screening now?
Thing is, when these age brackets were even being established, it was from a place of, have you been exposed to HPV, especially to do with sexual contact? Even if someone, for example, someone who's born with HIV, it's different. So obviously, maybe someone may have been born with it and they haven't yet been exposed sexually. But the point is, if you have been sexually active before, the risk of you having caught HPV from your sexual partner is high. So we would encourage anyone who's sexually active to go for screening, for regular screening. And that's basically how they came up with the age brackets for the same. They assume that by a certain age you've been exposed to sexual activity, so you should go for screening.
Speaking of screening, how do we screen for cervical cancer?
Okay. So there's different ways of screening. It's very, very easy. The first thing or let me not say the first thing, but the most common one, at least especially in our government facilities, is what we call VIA.
Yes.
It's like visual inspection. Okay.
And acetic
So
acid,
yeah,
yes.
so you go into a very private room. You have your healthcare worker there. They have a small, I'll call it a camera, if you like.
Yeah.
So obviously you have to sit draped. You part your legs, and then someone goes in with a speculum to open up, and then they're able to connect some kind of camera to visualize what's going on. Then they put acetic acid, your normal everyday vinegar, which is why it's so cost effective.
I'm sure some people
putting vinegar. No, guys. I'm not telling people to put vinegar.
They want to see.
Take home message: do not put vinegar on your own in your vajayjay. Please go for proper screening by a trained healthcare worker.
And speaking of putting things in a vajayjay, people put nsunko, tobacco, in the vajayjay,
amongst many other things.
And tobacco is one of the risk factors for getting cervical cancer.
Yeah.
And you're directly, applying it.
Directly putting that. It's like you're saying, cancer, come here. Please avoid smoking. Don't put nsunko in your lady parts. Don't sniff it. Just avoid tobacco products.
And there are people doing both.
Sniffing
and
sniffing both ways. Oh my god, that is so messed up.
And shisha also, that is tobacco.
Yeah.
So in the long run, it may predispose you to having cancers. Not just cervical cancer, lung cancer.
And you also have just
breast cancer,
vascular disease. There's just so many complications with smoking.
It affects your blood vessels. You find that your toes even fall off because
they can.
Your blood vessels are not properly supplying your toes or your fingers. So,
and Dr. Yvette, I'm so happy you've mentioned shisha, because people assume that because it smells nice and it's flavored, it's not smoking.
Yeah, because
it's actually
bougie.
Much worse than a cigarette smoke.
Yeah.
Like
I heard that it's the equivalent of having 100 cigarettes.
Yeah. Wow. It's crazy.
That's a lot.
But back to putting things in the vajayjay. Please, on a side note, the vagina is a self-cleaning organ.
Yes, it
Beautiful organ as is. Don't put strange things in there. Don't say you want to bath with Handy Andy or Domestos in the name of... No. I've encountered people who ask, can I use Handy Andy? I just want to smell fresh. Learn what your normal smell is. We all have a scent. I'll call it a scent. Let's not call it a smell. We all have a scent. Learn what your normal scent is and grow with it. Don't put handy Andy to clear that scent. Don't put domestos. Don't leave it alone.
Yeah, we actually advise people to use water.
Just
Although
water.
there's still a debate on whether these feminine products are helpful or not.
Well, I would just say external genitalia wash. That's fine. Like, I mean, it's just hygiene. But don't go inside, swooping around. Like, leave it alone. Leave it alone.
There's one lady who came in and she's like, I felt like a pimple inside. I was like, madam, what were you doing inside?
With the pimple. I don't mean to laugh.
And she was like, Posamba. I was like, no.
No, but that's a common practice, unfortunately. People think you have to swoop in, take things out. No.
No,
it's
and
self-cleaning.
that's why, on a side note, that's why people are getting a lot of yeast infections, because you're destroying the pH of your vagina.
Yes, it's meant to be acidic. Now, when you introduce soap there, you clean things out.
Yeah.
You kill the healthy bacteria that are meant to balance things out. You get yeast infections.
Then, yes, the yeast just flourishes. Anywho,
We've digressed the whole
I know. I know. So
but
back
it's important.
to yes, it is very. So back to the screening. We've talked about VIA, which is the visual inspection and the acetic acid. So you said they put the vinegar.
Yes. So the acetic acid is placed on the cervix that they're visualizing on a small screen, and then they look out for changes. So there's a certain way that pre-cancer cells react with the acetic acid, and it will show, and they'll be able to detect there and then.
Yeah.
And on top of that, if they see a lesion, what we call medically a lesion or something wrong there, they're actually able to take a sample there and then. And depending on how deep it is, they can actually completely remove the part that is affected. That's why we say that in a screening session, you can actually get your first line treatment if you have the pre-cancer changes.
I'm actually happy that this was introduced.
Yeah.
They call it the see and treat.
Yes.
So when they see that the precancerous cells, because the precancerous cells with the vinegar produce this reaction, and there's like a white cloud over the cervix, and once they do that, it's see and treat. So either they burn it.
Yeah.
So they either burn it or they freeze it.
Exactly.
Or as she said, depending on how deep and how big it is, they remove the lesion. And actually, that's another way of screening. If you see a lesion, then you remove it.
You take a biopsy. Yeah.
Yes. You take a biopsy, and that tells us whether the lesion is cervical cancer or not.
Exactly.
And that's stage 1, yeah?
Yeah,
of cervical
much.
cancer, because when the cancer is confined to just the cervix
alone,
that's 1. And then in the second stage, it's the cervix, and it moves to the upper 2/3 of the vagina.
Yeah.
And in the first 2 stages, the treatment is surgery, yes?
Pretty much, yeah.
Yes, because they can remove the womb or
the
just remove the cervix, depending on, every patient is
unique.
Yeah.
Yeah.
So
there's no one size fits all, basically.
Exactly.
You treat what you find.
As they say, diseases don't read textbooks, so you won't present like a textbook. So depending on how you present, they'll either remove your cervix or your uterus.
Yeah.
Then in the third stage, in stage 3 now, this gets a little complicated. So there's a role for surgery, and also they do radio and
chemotherapy. Yeah.
So in stage 3, it involves the cervix, but then it moves to the 2/3 of the vagina and to the lower third of the vagina. And it also affects your kidneys.
Unfortunately.
So your kidneys start collecting
toxins, for lack of a better term.
Yeah. And so they enlarge, and because your urine is not coming out, so there's like a back pull of
like there's a blockage,
so I'm trying to be as simple as possible.
In short, it's moved from all the way down here, and it's starting to creep up.
Yeah. Then in stage 4 now, it's moving away from from the pelvis. So in stage 4, it will first affect the organs that are close. You have the rectum.
Yeah.
Then you have your bladder. Then after this starts going everywhere. It goes to your...
It can also affect the spine. Those that
Yeah,
people
it
show
goes
up
to your
with back
spine.
pain, you know.
Can go to your brain, to your
Yeah.
lungs. Can go anywhere.
Practically
So
anywhere.
when you get to stage 4, and surprisingly, people come in stage 3 or 4.
Yeah, unfortunately, for something that we said is treatable and preventable. That is why we are talking about it in the first
Yeah.
place. And you may not know, or some of you do already know, January is Cervical Cancer Awareness Month. We should have been wearing turquoise. Why am I wearing turquoise?
I'm close.
I'm okay. The leaves
You have,
on my
yeah,
on my-
you have some.
Yeah, I
Yeah.
have streaks of turquoise somewhere. But yes, January is Cervical Cancer Awareness Month.
Yes, which is why we're also talking about it.
Exactly. And this year's theme is prevent, screen, and learn. Because this thing is preventable. Even if you've been exposed to HPV, screening helps catch it early and treat it early.
Yeah.
You know, some people don't have to get to stage 4. It's sad to see that people get to stage 4 and we do lose enough lives to this cancer. So let's do what we can to prevent and screen and learn. I mean, this is the purpose of learning.
You know, the health seeking tendencies in Zambia, they're quite bad.
They are quite bad.
You find someone comes in stage 3 or 4,
Yeah.
and they'll have ndembos everywhere.
Even
And
where there's no
get,
swelling,
yeah,
where there's no pain.
and you know, when someone has ndembos, it means that it's a chronic thing. They've had this
for a
thing for a
long
long time,
time.
and they've gone for treatment to the traditional healers.
Yes.
Yeah.
When Dr. Chabulela Kumanda and them, you know, yeah.
Yeah, so people would do rounds before they come to the hospital. And then when you come to the hospital, you start saying that we're not doing anything for you.
But you've come in a place where there's not much we can do.
Yeah.
Or we are limited in what we can do.
Yeah, because the only thing we can do is make you comfortable.
Yeah.
It's end of life care.
When you get to stage 4.
Yeah.
Yeah.
When you get to stage 4, because we're just making you comfortable, which is very sad.
Yeah.
I just hope the health seeking behavior
Will improve. Yeah.
I understand that, I mean, we're still a developing country.
Yeah.
Some people don't have access to health facilities, but I think we've improved.
And we're trying, even just with
yeah.
information. I mean, we have social media that people have access to.
Yeah.
I mean, if you can sit watching a comedian all day, you can use the same social media to look at stuff concerning your body, your health, you know? Like, learn. Like, I love the theme personally. It's simple, but it carries so much in it.
Yeah.
You know, learning your body, you know? I'm sorry to dive right into it, but signs and symptoms, learning your body. Some people have foul-smelling discharge. And thing is, because of the way we're made as females, like our genital parts tend to be wet, you know?
Yeah.
So you need to be able to differentiate when, you know, it's just your normal cycle, there's that normal cervical mucus, because we get changes in our mucus throughout the month.
We do.
So you need to know what your normal smell is, which is why you should avoid washing your lady parts with
because you won't know.
Exactly.
You want to be smelling like roses. Vaginas don't smell like roses, guys.
It would have been a rose if it was supposed to smell like one. No, it's true. So you need to learn what your body is like. What are your smells? What is it like, you know, before your period, after your period? Learn your body, you know, such that if you have a strange discharge, you know there's something wrong and you'll be able to go to the hospital or clinic.
You know that some people don't even know when their periods are. They come to the hospital and you ask them, when were your periods? And they don't know.
Yeah.
They're like, sinizi kapena enze mchan. Momach.
And she's scratching her head. I don't know. I'm not you.
Yeah.
We're not magicians, you know. Doctors work with information we're fed.
Yeah.
Yeah.
So if you don't know your menstrual cycle, you won't know when you're having abnormal bleeding.
Exactly.
Because you're going to assume that's
your period.
normal. Yeah. So if you know your menstrual cycle, if you have spotting in between, you'll be like, no,
this is not
normal. But if you don't know, you just be like, yeah, these are my periods. Probably just come maybe a few days early, because you don't know.
Yeah.
And you should also know your your flow,
Yes.
what's heavy and what's
What's
not.
light for you?
Yes.
Yeah. Your normal bleeding days. Are you a 3-day girl? Are you a 5-day girl? If we're getting to 10 days, that is not okay.
Yeah.
Go to the hospital. Because you have people, oh no, I've been having it for 10 days all my life. And you never went to the hospital, you know.
That's not normal. Periods, 3 to 7 days.
Yeah.
Yeah. On average, like 5
On
days.
average,
Yeah, but any more than that, that's abnormal. And that's one of the signs that you see when you have cervical
Abnormal
cancer.
bleeding.
Abnormal bleeding. Especially if you're menopausal, because cervical cancer has a tendency to affect women who are above 50.
Yeah.
So that's usually like someone is hitting menopause.
Yeah.
And you haven't had your periods for 3 years, and you see some bleeding.
Exactly. All of a sudden.
That's abnormal.
That
Come
should
to the
scare
hospital.
you. Yeah. It
You
should
know,
scare you.
I had a patient, she was 60 something, and the daughter was telling me when I am a period. I was so confused.
Okay.
For 20 years, this woman didn't bleed.
Have her period.
Then she had her period, and they didn't bring her to the hospital. They brought her afterwards when she became anemic and she had...
no. So meaning the cancer had already done its due diligence. Oh my God. Okay.
She had one of the female reproductive organ cancers.
Oh no, that is really sad.
I think she had endometrial cancer.
That's sad.
Yeah.
That is why we need to learn our bodies. We really, really do. I mean, if you have a smartphone, get a period tracker. You know, they're free ones. You don't even have to pay for it. You just, when your period starts, you input. When it ends, it inputs, and it will calculate for you the next one. Or if you don't have a smartphone or you're not a smartphone person, a diary. That's how old school people used to do it. Keep it in a diary. I mean, sometimes we all don't remember. Sometimes we forget. I'm like, was it the 5th or the 7th? But keep a record just for your own sake. There's no harm. You're doing it for you. You're not doing it for the doctor or the nurse. No, you're doing it for you.
Mm-hmm. Yeah. You're not doing it to make our lives easier. You're doing it for us to help you.
Exactly.
Save your life. And I know there are things that will affect your periods, like use of contraception. Yeah, but you should also come to the hospital and ask if it's normal.
Exactly.
You may stay away thinking that your periods are not coming because of the contraceptives,
but it's something else altogether.
And you find that you're pregnant.
Exactly. There's enough people who think they're on their period and then show up at 30 weeks, 35, 40 weeks even. And, you know, someone just...
like, but I was on Jadel or something. But you're actually pregnant. It happens. But I'm not saying it's common. I'm just saying it happens. It happens. There's nothing that's impossible when it comes to medicine
and science to shock you.
Mm-hmm. So some of the other signs and symptoms would be abdominal pain.
Yeah.
And pain during sex.
Exactly. Pain.
Sex, I don't think
it's not meant to be painful. So abdominal and pelvic pain during the act, and also bleeding during or after the act, that's not considered normal. So if you are having pelvic pain or abdominal pain when you're meeting someone or having intercourse, please go to the hospital. I'm not saying it could be cervical cancer, but it does mean there's something wrong for sure.
Yes, there is. And people just want to be strong. Yeah. Especially the women.
Because being strong like that has never helped anyone. Like, do it for yourself.
Not at all.
Yeah.
Yeah, because I don't know if it's the African tradition that teaches women to be strong.
I really don't know. But that's why we're having this conversation.
There are women who really go through pain.
Yeah.
I had a woman, I think I've told too many stories. I had this lady came in with massive genital warts.
Oh no.
Massive.
Oh no.
And so these warts started from inside the vagina and they came all the way out. So they started inside, then they started coming out. And I asked her, like, but mommy, where have you been for them to get to this level?
Yeah.
And she said that her husband stopped her because as they were growing, they were reducing the size of the vaginal canal.
Oh.
So, yeah.
But that must have been painful.
It was. So until her vagina was almost completely closed.
Oh my goodness.
Then she was like, I couldn't take it anymore. I just had to come.
Okay.
So there are women who are going through
The most. Please, pain
it's
is
very
not enduring. Pain is not a sign of strength, or pain is a sign of things going wrong. Sorry to take you
Yeah.
back to med school or biology, but it's it's the part of inflammation.
Yeah.
When things are going wrong, it's a signal to tell you something is not okay. So if you're experiencing pelvic pain, especially during the act, bleeding during the act, some of you, unfortunately, by the time you're reaching the place where you're getting lower back pain, it means it's spreading.
It's spread, yeah.
Yeah, but
Most
all
like
these
it's
are
even gone to your
signs
spine.
of cervical cancer.
So some of the other signs, depending on where it's spread to, if it's
Yeah.
gone to your rectum, for example, you're going to have going to be bleeding when you're passing stool.
Or
You may
getting
have
constipated.
yeah, you
even.
may have difficulties in passing stool as well.
Yeah.
If it's gone to your bladder, you'll be seeing a lot of blood in your urine.
Yeah.
Sometimes people even come with a connection between the vagina and the bladder.
Yeah.
So you find that urine starts leaking out of your vagina. Sometimes you even have a connection between the vagina and the rectum. So
yeah.
you have fecal matter coming out from your vagina.
But that's
Now-
obviously in the advanced
Those
stages.
are advanced stages now. And ish.
We don't want people to get to that. And the unfortunate
No,
thing
we do
is
not.
the early stages are symptomatic.
Yeah.
You won't have symptoms, which is why screening is so important. Anything, when you are screening for anything, it's not that you are looking for something in particular, but you're just trying to filter it out to say, could it be there?
Yeah.
That is the purpose of screening. It's like when I, take your BP when you come to the office or whatever. It's to say, okay, could she be hypertensive? Is there something that could be leading her to the way she's feeling? I'm just screening. So
Yeah.
screening is so important.
Especially for cervical cancer because it's really a nuisance.
It is.
And you find that some people are scared of they're scared of the vinegar. They've heard stories that it's a very painful procedure. Some are just scared that they may find the cancer.
Yeah.
It's like when you go looking for something, you
You'll
find it. So
But really, ignorance is not bliss. Do not be deceived. Ignorance is not bliss, because you don't have to show up with stage 3, stage 4, where was now
Yeah.
trying to give you fewer options.
and the screening takes literally 5 minutes.
Yeah.
5 minutes, you're in and out.
Yeah.
And if they do find a lesion, they'll either burn it, freeze it, and tell you to stay away from sex just for a little bit.
Yeah.
Now, that's another part people don't like telling them to stay away from sex for
But
like 6
this is
weeks.
where you weigh your options. Like, we really need to learn to invest in our health.
Yes.
The same, if you're willing to spend 5 pin on a bottle of bubbly or whatever it is, you should be willing to invest in yourself, by exercising, eating healthy, and a regular checkup. Like, your health truly is your wealth. Because you can have so much money, but if you're sick, you won't even enjoy it.
And screening is after years. It's not like you screen every month.
Yeah.
For cervical cancer, that is.
Exactly.
It's not every month. It's if you're HIV positive, they screen you often.
Yeah, they
so
do.
it could be like 2 years. Depending on what you had, they can even give you a year, but they give you more time when you're HIV negative.
Exactly.
For reasons that we've stated. So
Yeah.
please screen.
Exactly.
Is there anything else that you'd like to talk about that we haven't covered?
I think we've covered. Oh, no. One important thing. We've talked about screening because you can see and treat, which is where the prevention and treatment comes in. But primary prevention.
Oh, yes.
Vaccinating
Yes.
our
Oh my
girls.
God. Very
with
important.
HPV.
Almost forgot.
People are so skeptical about things. I understand. I mean, when you have children, you want to protect them.
Yeah.
You can ask your questions, and it is important to ask your health practitioner, what does it do? What does it not do? But
Yeah.
there's certain myths say, oh no, if my daughter gets the HPV vaccine, she'll never have children. Yeah, you hear different myths about these things. It's kind of like how when the COVID vaccine came out, oh no, it causes impotence. You know how it's always to do with.
There was that.
Yes. We had to spend a whole bunch of series demystifying COVID vaccines. Yeah. So please, HPV vaccine helps prevent cervical cancer in the future for the younger population.
Yeah.
The vaccination age in Zambia is 9 to 14, isn't it?
Yes, 9 to 14 because, yeah. we're still trying as a country,
Yes,
but
yes.
there are countries out there, developed countries that are going up to 25.
Exactly.
And developed countries are giving both sexes, so they're giving the males
And
the females.
Yeah.
We're not yet there. We're
But we will
getting
get
there.
there.
We're getting there. So what the vaccine does is that we give HPV, a weakened form.
Version. Yeah.
A weakened form of the viruses. So we give you the high risk viruses, because there are different types of vaccine. There are some that just have HPV 16 and HPV 18, and there's some that have more variants like HPV 31 and HPV 33. So that's what we're giving them. So what will happen is that the body will produce antibodies that will fight against that weakened form of the virus, so that in future, when they ever encounter these viruses, they're able to fight them off, because they already have the soldiers are already there waiting.
Like they have memory to say, wait. We know you. We know how to deal with you, and then
We've seen a version of you before. You may have been weak, but it is you.
it is you. Exactly.
Yeah, but unfortunately, if we give you HPV 16 and 18, if you encounter 31 and 33, you still have a chance of getting HPV.
But the good thing is vaccination reduces the risk of, getting the full-on infection.
Because you really never know. And it's just sad, although they're still working on it, we don't have a routine test for HPV. Like the way we have, HIV, we have for syphilis. We can just get some blood, put it on a strip, and to tell us whether you have. Unfortunately, we don't have that for HPV. So you can't take your partner to the hospital and say, please check if he has HPV or not. It's very unfortunate. I hope we get a routine test soon.
Yeah. Like at least a rapid one. I mean, they can screen the blood for the same, but it takes a bit of time.
It does.
It takes a bit of time.
And unfortunately, they do it after you already have symptoms to see if you actually
have it or not.
Yeah.
Like we said, HPV is a nuisance, a total nuisance.
And it's actually the most sexually transmitted infection out there.
Exactly.
People think it's HIV, but no.
HIV has ARVs,
Yeah, and people are doing really well on ARVs.
Exactly. But HPV,
like people come to the hospital and they're like, oh, I'm HIV positive. I'm like, girl, looking well.
Exactly.
Looking well. And then there's some who come to the hospital. Anyway, let me not get into that.
Let's not go into something else.
Yeah, but thank you so much for coming.
It's been an absolute pleasure. Thank you for having me.
And guys, remember to prevent, screen,
and learn.
So this is learning.
We are learning.
Yes. So now prevent, especially if you have a girl child, make sure they're vaccinated.
Yeah, and go for screening. If you've been sexually active before, or you are sexually active, go for screening. If you're scared to do it alone, haven't you noticed most hospitals will have like 2 seats in the consultation room? It's because we assume you always come with somebody. So grab your sister and say, let's go.
We're not saying that your sister will be looking at
your
the
lady
whole
parts.
No. They'll just be there.
Support.
Yeah.
Yeah.
Comforting you, holding your hand.
Yeah.
Yeah. It can be uncomfortable. The speculum can be uncomfortable, but it's something
better than the discomfort of knowing that you're dying.
Yeah.
Or your kidneys are short, or the cancer is spreading. So weigh the bad. Which one is worse?
Just 5 minutes in a screening room is what I'll choose.
Exactly.
So thank you for joining us today. We're talking about cervical cancer. We hope you really learned something. So join us for another episode. This was Health with Dr. Yvette.